Hi everyone, we are Group 2. Our names are Ding, Parsa, Serena Joy, and Stephanie, and our presentation is on the policy HR 1230 Food Deserts Act.
There are millions of people, both adults and children, that go to bed most days without a substantial nutritious meal. They reside in places called food deserts. Food deserts are places where residents don't have anywhere close to where they live to purchase/get healthy, nutritious, inexpensive foods like fruits and veggies. Those who are most affected and suffer the most are from underserved, marginalized populations and communities that get overlooked a lot of the time. They are people of color, most notably Blacks and Hispanics, people living in rural areas, people living in poverty, and people who are part of families with kids and one head of household. Thus, those that are impacted are food insecure. To be food insecure means that you do not have access to food, or you cannot afford to purchase food. The figure on the left demonstrates that what I had explained earlier about who is most impacted by food insecurity. As we can see, in each area there is some sort of increase, thus more and more people are left without means to get food. In fact, it was recorded that about 44.2 million households in the U.S. are food insecure, comprising of 11.7 million adults and 7.3 million children. The figure on the right illustrates how severely each state is impacted by food insecurity. We can see that those in the rural South of America are hit the hardest in states such as Texas, Oklahoma, and Alabama. The consequences of food deserts and food insecurity is that people involved and affected by them are more likely to suffer from chronic conditions. Here, this graph shows that in a study done by the University of California, San Francisco, data taken from 15,000 young adults demonstrates that those that are food insecure experience obesity, high blood pressure, airway conditions, like asthma and other pulmonary diseases, smoking, and depression more than those that are food secure. HR 1230 has been introduced in-house as of March 22, 2023, and passed along to the Subcommittee on Nutrition, Foreign Agriculture, and Horticulture. It is yet to become enacted. It is a federal law and standalone bill. The federal government will provide loans to places with underserved communities, places verified as food deserts. The money is for grocery stores to be open or to continue sustaining those that are in the area. However, clarification is that it isn't to build new ones from the ground up. It's more so about assisting the ones already there. This is because the people in these areas are food insecure and have little access to inexpensive produce and other healthy food options due to living at or below the poverty line. There are requirements and regulations for these areas that receive this aid, and they are placing importance on organic, unrefined foods, having inexpensive prices, offer a diverse arrangement of fruits and veggies, have employees to work at the grocery store, educate community members about what a healthy diet consists of, exhibit some sort of reliable supply chain / source of their products. This is so that the government can make sure that the implementation is effective and so that community members are involved.
So here are 3 related policies that also aim to tackle food access challenges. At the federal level, we have S760, which proposes reauthorizing funds to attract grocery stores into food deserts. At the state level, AB 2090 aims to ensure that all students have proper access to nutritious lunches. It also proposes providing transportation services to connect food deserts with supermarkets. Lastly, AB 311 proposes expanding SNAP eligibility by removing restrictions on age and immigration status in California. All of these policies have received very positive feedback from Congress members and the general public. Congresswoman Braun expressed support for the Senate Bill 760, stating that access to healthy foods should not be restricted by a person's zip code. Independent grocery store owners also stated that these financing initiatives have been a great resource for them. The SNAP program, which SB 426 is seeking to expand eligibility of in California, has also seen successful implementation across all states. The graph on the right shows that while the majority of states received funds from the previous financing initiatives, not all the states did. So this highlights the ongoing need for a policy that not only provides financial support, but also offers a more holistic solution, such as our Food Desert Act. Our Food Desert policy is introduced by Andre Carson, who has always been concerned about the lack of access to health services. And on the right are the names of other co-sponsors of this policy. The figure on the bottom shows the organizations that have shown support to previous financing initiatives. There are also potential funders for our policy, as they're committed to promoting food access.
This is our logic model on the HR 1230 Food Deserts Act policy. The first activity we distinguished is grant allocation. The policy will see to dispersing fundings to state according to bids for creating and sustaining food businesses in underprivileged areas. The first input for this activity is financial resources. The policy ensures funding from the Department of Agriculture for establishments and upkeep of the grant program. The second input is fund allocation. Funding will be provided for data acquisition and data analysis on applicable supermarket locations, neighborhoods' SES levels, and existing products in stores that need assessments. This data will provide the public community health workers the knowledge of food deserts. The output for the grant allocation activity are the funds distributed based on assessments for food businesses in underprivileged areas that fulfill the bill's requirements conducted by financial experts.
The second activity is education programs. The policy will distribute class materials on nutrition education developed by experts and will relay that material to grocery stores and train the grocery stores on how to best deliver these classes and materials. The first input for this activity is expert specialists. Expert specialists with expertise in food security, nutrition, and retail grocery operations will assist in creating, executing, and overseeing the programs. The second input for education programs is nutrition education. The policy includes hiring teachers, dietitians, health educators to create educational materials and lesson plans from available resources online. They would also implement this nutrition education by training grocery store staff. The output for education programs will introduce many more educational initiatives on nutritious diets, which will be launched by sponsored grocery retailers or nutrition education classes. Through both activities, it is expected that the short-term outcome will enhance availability of cost-effective, nutritious food in marginalized areas, and it will also improve the community awareness and understanding of nutritious diets. The intermediate goal is that the policy enhances dietary practices in disadvantaged areas, and it will increase employment rate by hiring workers from those underprivileged areas. The impact or long-term goal of the policy is expected to make a decrease in rates of food insecurity and hunger in underprivileged regions. It is expected to enhance public health and decrease diet-related illnesses such as depression, obesity, diabetes, heart disease, and etc. The policy will also enhance local economies by promoting local agriculture, by sourcing their foods from local family farms, and generating employment opportunities.
Next, it's paramount to investigate evaluation questions based on the logic model. By looking at questions from 3 different time periods, we can effectively evaluate the policy's impact. For short term, did HR 1230 increase the knowledge of the availability of cost-effective nutritious food in marginalized areas? For intermediate, did HR 1230 increase the employment rate in the food desert communities that received grants? And for long term, what economic benefits have been made in local economies due to the promotion of local agriculture and the generation of employment opportunities from HR 1230?
We're evaluating the intermediate outcome question, which is did the policy increase employment rate in the food desert communities that received grants? We've chosen the quasi-experimental design and specifically the time series design. This means that we will collect data on employment rates at multiple points before and after the policy. The first reason for choosing the time series design is that we're unable to randomize our participants, as it just wouldn't be ethical and feasible to deny people access to the benefits of our policy, especially those are the people most in need of access to healthy food. And since this is a federal level policy that will be implemented across all states, we also couldn't use a group comparison pre-post design, so that just leaves us with time series design as the best option overall. The second reason is that historical data on employment rates are very well recorded and searchable by industry code and zip code, which will allow us to narrow down the data for more detailed analysis. So we're using data collected from the U.S. Bureau of Labor Statistics, and we will specifically use the County Employment and Wages database. First, we will extract employment rates from food and beverage stores using the code, and then from the zip codes of the food deserts that received grants. And once we have all the desired data, we will compare the employment rates from 3 quarters before the policy with those from 3 quarters after the policy to detect any increase in employment rates. Since we're evaluating an intermediate outcome, collecting data on a quarterly basis seems the most sufficient.
Next, we need to look at the evaluation challenges. In 2019, about 31.9% of children in poor households below the poverty threshold did not speak any English at home in the United States. So we would need to make sure we're able to relay these opportunities to people that speak different languages. Addressing language and cultural barriers is crucial to ensure equitable access to the benefits of the policy for all underserved communities. Next, we would not know if the increased employment rate is solely due to this policy. Other local policies, such as CalFresh, are also dedicated to providing more jobs in a very similar way. Without a comprehensive evaluation framework that accounts for various influencing factors, it becomes difficult to ascertain whether observed challenges in employment rates are solely attributable to the policy in question or influenced by external factors. Lastly, though we're able to gather data by industry code to see how many jobs are created in the food and beverage stores and retailers, we might overlook jobs created by miscellaneous store retailers who also received our funds/exposed to our policy. Without robust data collection methods that capture employment impacts across all relevant sectors, there is potential for underestimating the true extent of job creation resulting from the policy.
The Food Deserts Act of 2023 may improve health equity by tackling direct and indirect issues. The bill improves access to healthy foods, local economies, and nutrition education to reduce health disparities in underprivileged areas. To start off, this policy will improve limited healthy meal access because there are many individuals of low income who typically can't afford nutritious meals, which can cause diet-related illnesses. The policy can lessen diet-related health inequities between the affluential and the poor by boosting access to healthy foods. Secondly, the policy will improve the employment opportunity issue. Economic volatility worsens health and unemployment in underprivileged areas. Local employment improves economic stability, which may enhance nutrition, health insurance, and stress. Thirdly, the policy will address the issue of healthy diets education. Poor nutrition education causes food issues and health inequities. Healthy diet workshops and resources may improve food choices and minimize diet-related health inequities. Lastly, the policy will help the equity concerns and policy impact. Access to healthy food among underrepresented communities is expected to reduce health disparities and enhance health outcomes. Job creation and local economy assistance may indirectly reduce health inequity by enhancing economic stability, which is closely connected to health. Educational initiatives for underrepresented groups may minimize food-related health inequities and increase health.
Our open-ended question is, how can the policy be modified to be more culturally sensitive and reflect the ethnic and personal diets of underserved community members?